Hello again. I come back. I'm Dr. Atta, also known as Kapwi. Yes, I'm just here to continue the series on vaginal discharge. If this is the first time we're meeting on YouTube, yeah. I am a general practitioner. I studied at the University of Botswana, and I've been working for 5 years now. Yeah. Okay, so with vaginal discharge, you get physiological and infectious causes. When you have a vaginal discharge, you should never be ashamed or embarrassed about it because it can literally be anything and it can happen to anyone. Today we'll be covering the infectious causes of vaginal discharge. So STIs, sexually transmitted infections, there are two very common ones, which are gonorrhea and chlamydia. They are very, very common. So how you get them is if you have unprotected sex with anyone, you can contract the infection. Most people are asymptomatic, so you wouldn't always know if someone had the infection until one of the partners starts to present with signs. Some of the signs or symptoms that you might have are low abdominal pain and a vaginal discharge. So with chlamydia and gonorrhea, the discharge will be increased in the amount in volume, and it would smell bad. It would also have a green to yellow tinge, which can also be quite uncomfortable when you look at it. So there is treatment for STIs. You would go with your partner to get an injection and tablets, and this would usually clear off the infection. So there is another infection that isn't necessarily an STI, but can predispose you to getting STIs, and it looks like an STI. It is called bacterial vaginosis. Bacterial vaginosis is a very difficult infection to treat. It is caused by overgrowth of bacteria that is naturally found in the vagina, and it causes an increase in your vaginal discharge, and it can smell quite bad. It usually smells a bit fishy, and it's not anything to be embarrassed about. It is something that sometimes your body can clear it off on its own, but usually you'd have to take antibiotics for a prolonged period of time. If you do have any types of discharge that are of concern, definitely see your doctor. The reason why it's important to treat infections early on or when you notice them is that the way infections work, especially with vaginal hygiene, is they track up the vagina into your uterus, your womb, and then it can also spread into your fallopian tubes. This causes inflammation and can cause blockage of your tubes, which can decrease your fertility. So it's very, very important that you get treatment and your partner gets treatment as well, so that there's no complication later on caused by the infection. Definitely. So if you are having unprotected sex with your partner, it is very, very important to be able to be open with each other and speak freely about things like discharge, because in the end it's something that affects both of you, and if you get treatment together, then the cycle will not be perpetuated. So definitely, if you can have safe sex, which is using a condom, it is recommended that you do so. But if you have chosen to have unprotected sex, you should feel free to discuss this with your partner and get treatment as a couple, because in the end the discomfort will be decreased for both of you. Okay, So to get treatment for any form of STIs, you can go to a private facility or a government facility. You don't need to see a doctor, you can see a nurse. If you have lower abdominal pain, I would recommend that you see a doctor. Sometimes what happens with the infection when it tracks up is it causes the swelling of the uterus, and you can be diagnosed with something called pelvic inflammatory disease. It has different gradings depending on how severe it is, and it does have treatment. So the sooner you get treatment, the more relief you can get. So if you're watching this video and some of the symptoms that have been mentioned, like low abdominal pain and discharge, is something that you've experienced, don't worry. Don't think of the worst case scenario. Usually, if you just go to the clinic or to your local doctor, you can get treatment and this will be relieved. So don't be so harsh on yourself and don't stress about it. But definitely get treatment. Thank you for joining me today. I hope you found everything that was spoken about informative. You can obviously do more research if you want more further detail, but yeah, I hope I helped relieve some of you. And our next topic is period pains. Thank you.